Appreciate your being on. We'll go through it. I know President Trump, as of Friday, was talking about no lockdowns. We're not doing lockdowns and all sorts of bravado. But the reality is the Biden team can't wait to get in there and to start doing things that might put a dent in this pandemic. Right now, it's happening state by state. What worries you the most?
Good morning, Mika. You know, what worries me the most here is that you can't have 50 different approaches here. And what you're seeing here in Washington State and what Governor Inslee did, that is unfortunately a framework for what makes sense if health systems are about to undergo complete overrunning and filling up of their ICUs. And so this is the type of action one must take if they're leading a state 1 to 2 weeks before a catastrophe is expected. And that's what we're seeing here in Washington State, 4,000 new cases, complete spike from where we were as the initial epicenter. You're seeing similar trends in Missouri, where ICUs are near capacity, Utah, South Dakota. But Mika, the concern here is 50 different approaches here, in some cases, no approach at all. Not in South Dakota, again, in the Dakotas, places like Iowa, no action on basic things like masks. So this is not going to get controlled if we're going to have maybe no approach or an aggressive approach. We need a unified approach, which is the reason why there's a deep concern about the delayed transition and the impact that's having on planning over the next 2 months.
So you have a delayed transition happening, Dr. Gupta, with also testing very much hodgepodge. I mean, if you want to test, you can maybe get one. It might take a while. And then it takes a while, potentially, sometimes way too long, to get your results as the virus is potentially being spread. I mean, this is a cluster of epic proportions.
You know, make no mistake, Mika, actually, we've heard from colleagues here in Seattle that drive-through testing, which has now been viewed as the off-ramp. If you need to get a test, go to a drive-through test, make an appointment. They are booked out for the next 8 days here in Seattle. We had a couple that was trying to get their child tested to see whether or not they were potentially safe to go back into a childcare setting. That's where we're at now. We're back to delays in testing. We're back to families not being able to access basic testing to plan their lives if both parents work, potentially. That is the challenge right now. So that's a huge issue here. What I thought Governor Inslee did was interesting, because with holidays approaching, he said, his Department of Health said, no indoor gatherings whatsoever with people outside your home unless you've quarantined for at least 7 days and you've tested within 48 hours and that test was negative. How are Americans going to be able to do that if there's not durable access to timely testing, number one? But then how do you enforce it? That's the difficult piece here. You need public cooperation.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.